Good afternoon. This is an exciting day for Henrico Area Mental Health and Developmental Services. It's my pleasure to welcome you to our 50th anniversary celebration and our new East Center. We will be spending a few minutes this afternoon reflecting on our rich history, hearing from several speakers, and recognize the significant contributions of 3 individuals. With us today is John Vitko, Henrico County Manager, and member of the Board of Supervisors, Mr. Nelson. We would not be celebrating today without the steadfast support of our mission and our work. I'm extremely grateful for their commitment to ensure residents have received critical services that promote recovery, inclusion, wellness, and self-sufficiency. I asked a few people this morning for words that came to mind when they thought of the agency. Here are a few: mission-driven, caring, innovative, advocacy, responsiveness to community needs, evidence-based practices, excellence, partnerships, collaboration, always willing, caring, compassionate, helpful, ethical, dedicated, recovery-focused, wellness, essential, hope. I invite you to think about these words as you listen to our speakers this afternoon. I would like to now invite John Vitko, Henrico County Manager, to come forward and share a few remarks.
Thank you, Laura. Thank you, Laura. Good afternoon, everyone. You know, it really is. Mr. Nelson and I were just talking about a number of events that we attend throughout the year, and I'm not sure I've seen one that has this kind of feel recently and this kind of participation. You know, this is a significant milestone, and as we reflect on the past, you know, the deputy county managers have heard me say many times, and many of the department heads, the employees, that we are blessed to stand on the shoulders of others. If you look at the history of this department, this county, we have the 2 former directors with us that literally started this whole effort within our county. I mean, Jim Stewart and Mike O'Connor. When I look at Jim, I can't help but think I've been with the county 24 years now. And when I first came to the county, I was actually Jim's budget analyst. We go back that far. And there were some interesting questions and conversations along the way, and we were always able to get you the funding, I think, at the end. But is that Terry? And Terry's here? Anyways, it was a great time. But if you think about the humble beginnings it started in 1969, to the emergence of this agency as a critical and extensive network of support to thousands of our residents and our surrounding community, not just in our county, but the entire, the surrounding communities that we envelop. 50 years, think about it, have brought many changes to this agency, from advances in medicine to specialized treatments, programs that go around the clock, but the pillars of human connectivity, dignity, and compassion have stood firm. You know, with your indulgence, I want to take a moment and pause because I mentioned Jim and Mike, but I also want to say that, you know, as a county manager now going into his 7th year, Laura Toddy has done so many things for our community, this agency, and I would say this county manager. And she is a truly, truly exceptional leader. And I think she puts forth the heart that is in this agency. And so I just want to take a moment and recognize, Laura, you are a rock star. And I'd also like to say thank you to Dr. Jessica Young-Brown, Chair of the Mental Health and Developmental Services Board, as well as all of our other board members that are here for the time and effort that they devote, because we know that, this is not what you do on a full-time basis. And finally, as we read the news daily or nightly, 24-hour cycle, and you see some of the things that we are seeing in our community and our nation, I would suggest to you that what the work of our mental health staff is the most important work that we are doing right now as a community. We have so many issues, it seems like, and the issues come and they go, and yet, our staff is able to do some Herculean things that are truly, truly exceptional. So I want to say thank you to all of the staff members for everything that you do, because I know you're not doing it for the pay. You're doing it because you're wired the right way, the way that many others should be wired. And so we know these services have transformed over the last 50 years. When the Henrico Mental Hygiene Clinic, is that what it was called? Opened its doors 5 decades ago, 3 individuals, just 3 were awaiting services, or so I'm told. And while awareness about the importance of mental health increased over time, so did the number of staff members in the array of offered services. Today's mental health and developmental services team of 400 serves approximately 10,000 individuals each year. They draw from a rich history of advocacy and partnerships, which still continues today. We can throw out impressive stats and data on what our team does, but what sets them apart, what makes me proud to be part of Henrico, is your heart, their heart for service. I see it in everything that they do, from how they patiently support and encourage their clients to how they selected the color scheme for this facility. I understand there's a story that is behind that. But I also want to thank Brandon Hinton, our general services departments, all of the agencies that were involved in making this facility a reality. I know Jim and Mike both had visions of doing something different, and ultimately this group was able to bring it forward. And nothing is possible, I've said it over and over again, without the strong support of our Board of Supervisors. And to that end, I want to say thank you to our chairman, Mr. Tyrone Nelson, for everything that the board has done in this realm, and ask him to come forward and share some comments.
Good afternoon. I see the crowd in the back standing, so I had a 20-minute speech. I'll cut it down to 2. Last week I was a part of a conversation about the future of Henrico County, and one of the comments that I heard was Henrico needs to do better as it relates to human services. And I wish the person that made the comment was here today to see all of you and whatever roles you play. I see different department leaders. See persons who are connected, whether it's mental health, developmental services. I see community partners. All of us together make up the work for the good of those who live in this county and in other localities. And so I just want to say thank you for everything that you guys offer up. Thank you, Mr. Manager. It's good to be back at the East Center. My prepared statements, just a few months ago, many of us gathered right outside to cut the ribbon. I mentioned to someone when I came in, it's my second time here, and every time I come here, it's hot outside. So I'm thankful that this activity is on the inside. Less than 2 weeks ago, we presented a resolution at the Board of Supervisors meeting to commemorate 50 years of service by this agency. This has been a busy summer for Henrico area mental health and developmental services. It is definitely good to have all of us here today. And so on behalf of the Board of Supervisors, it is an honor to be with you and help you celebrate the 50th anniversary of this agency. My colleagues appreciate your good work and the great service that you offer up, as well as I. As we think about this milestone, I think it's fair to say that the scope of Henrico's mental health program has evolved significantly over the past 5 decades, as the manager has shared. Terminology has become more enlightened. A sharper focus has been placed on substance use disorders. Financial and professional resources have increased. New treatment options have been identified and implemented. The role of local government has evolved as well. We have assumed more responsibility for providing services for our citizens. We have improved collaboration between county agencies, which has led to innovative programs such as the Crisis Intervention Team, the Crisis Receiving Center, and the RISE program, and better outcomes for our residents. We have also invested more resources, as demonstrated by this brand new facility. The East Center is just one example of Henrico's commitment to enhance and expand services for all of its residents. Through all of the changes, however, a few things have remained constant. This agency's clear focus on providing community-based service for the people of Henrico County, Charles City, and New Kent, and the commitment of this staff to see beyond the disability or illness and treat each individual with dignity, humility, and respect. I know these values will continue to guide you as you look toward the next 50 years. Again, I want to thank you for all that you do to improve the lives of so many in our community. We are grateful for your service. Congratulations on 50 great years. Now I'd like to invite Dr. Jessica Brown, chairperson of the Henrico Area Mental Health and Developmental Services Board, also a Varina District resident, to come forward and share some remarks.
For those of you who don't know the East End, welcome to how proud Varina residents are to be Varina residents. Thank you, Mr. Nelson, Mr. Vitolkas, and my friend and colleague, Ms. Toddy. I am excited to be here. It's my 6th year, I think, as a member of the board, and my 2nd year as chair. And one of the things that shines through if you interact with anybody who works with this agency is how much people care about the folks who walk through the doors every day. This is an agency that is committed to service, and so we would be remiss if we didn't take some time to hear from folks who have benefited from the good work that this agency does. And so I'm happy to present to you all 3 individuals who will share their stories and the impact that this agency has had on them. And I'm going to ask them to come in the order that I say your name. First, Mr. Desmond Stovall. Second, Ms. Rana O'Berry. And third, Dr. Alison Batchelder.
Good afternoon, everybody. I would like to thank everyone for the opportunity to get to speak about Henrico Mental Health. I started with Henrico about maybe a year or so ago. I started with the Friends for Recovery program, and I started out because I wanted to see if there was a place that I could go to with people who were like me, experienced the different things that I experienced, and could go through and I could talk to them about it. And I definitely found that in Friends for Recovery. We have a basic curriculum that we start by. It usually comes in by 8:30 to 9 o'clock was usually arrival time. From 9 to about 10:30 is our opening. We have groups. We talk about the agenda for the day. We talk about what's for lunch, most importantly sometimes. And we talk about different things, who's going to be there and different things like that. Followed by, we break up into 2 different departments. We have our culinary and clerical unit. When you start, you get to pick those 2, which one you want to go to. It's not necessarily that you have to stay in that one. You can flip and flop whichever one you want to do. After that, we break up into our jobs, our jobs that we have for the day, which is usually sweeping, mopping, shredding papers, making copies, texting, anything that we need to do for the staff and for our building. Most importantly, after that part is our first group for the day. Our topics tend to be on mindfulness, budgeting, medication training, how to make and keep friends. The staff does a good job at asking us what we want to talk about. That's most important to me because it lets me know that they want our opinion on most of all the topics there. After that is followed by the most important meal of the day, lunch. After that is usually a break of some time to just mingle with your peers. After that, we have another group at 2 o'clock. Like I said, any topics are open. Our staff do a great job with coming up with topics. We have great interaction every day between peers and staff. After that is usually leisure time again, and the departure time is usually from 4:45 to 5 o'clock. I'm very happy that I go to Lakeside Center. They do a tremendous job with helping us with as far as things go with learning about our mental illness, learning about how to take medication, and the most important thing is even if you're feeling better, to keep on taking your medicine. I know I had a problem with that several times before where I would be good and then I say, well, I don't need this medicine. But you have to stay on your medicine, keep talking to your therapist, your psychiatrist. Our case managers do a great job. My case manager is Quintana. She's not here today, but she's great. We do have one of our case managers here, Kevin. He's new to our staff, but he has been welcome, and he's a great addition to our family. And that's basically it. Like I said, I'm very happy that Henrico County has offered this program, and I would like to see more programs like this, more programs where you can go to a day program and even a weekend program that you can get out the house and talk with people who experience the same things that you experience, and hopefully, learn from them as they can learn from you. All right, thank you.
My name is Rhonda O'Berry, and I work at Hermitage Enterprises with Cara, my co-worker, and Beth and Erica. And it's Hermitage is Rico County, Hermitage Enterprises. And I do Meals on Wheels on Mondays. We go like after break, 10 o'clock. We come back like 12:30. And then Tuesday is Friendship Cafe. My friends, you got to be is a citizen, and you got to be 60 years old. They go out like activities, and we go to the way. And I live in a group home, Share Heights, and I love it. And let's see, when we get home, this is our plan each evening. I always remember what to do in the evening. All right, I'll put my lunch away, get home, put the dishes in my dishwasher, then 5 o'clock take pills, eat dinner, and then after dinner we do chores. We make lunch. After the chores get done, before we clean the kitchen, we got to clean the kitchen first before you make lunch. And then I do exercises every night. I did it last night when my cousin Trina was there, and she gives me some support, and Cara gives me support, and Erica, and everybody, and Beth, and the whole clan here. And part of living in a group home, we can't. Well, when they do medicine, we can't talk because if you make a med area, they will have to write it up, and we wouldn't want that for them. And also, they need a raise at the group home and at work. And here's my speech. Hello, my name is Rhonda O'Berry. Staff helps me with skills and STEP program 5 days per week. Some of the activities that we do is volunteer in the community for Meals on Wheels. We clean toys. Also, we clean toys on Friday, and I fax papers at Hermitage.
and I just enjoy it. Each day I get out, and then I go home on the weekend. I enjoy that too, and my 2 dogs. And go to book club at the library. I like to earn money by making money packaging and screw packaging the STEP program. I like my house at Share Heights. That's where I live. I like my housemates. I like the food. We eat healthy. I do exercise every night. Sometimes we go out to eat. We go shopping and volunteer at the park once a month. I do take trash once a month with me and my roommate Catherine. Pick up trash. And sometimes we have a lot of doctor appointments. They teach me how to take care of myself, and I'm being organized. My staff are great and always have time to talk. I also have a case manager, Glennis, who helps me take plans for my life. We have meetings, and she visits me regularly to make sure I'm happy and busy. I'll also be able to be on the safety committee and the agency risk management committee. I get to go to meetings with Emily, that's some of my other co-workers. Take my duties seriously, and I talk with safety with staff and friends. It's important to me to help others. Thank you for letting me share my story. And this is Rana over and Kim. She's one of my friends who came to my house one time. And Mary Beth tells me stay out of trouble, and I do. And this is Rana and over and out. Amen.
Hello, friends. I'm Alison Batchelder. I received substance abuse and dependent services, and I'm a board member of the Henrico Area Mental Health and Developmental Services, and for the past 4 years, and I am astounded. I'm truly astounded at the programs that are offered. Who would have thought that at the conception and the administration of a specialized mental health hygiene clinic in 1968 to 1969 would have become and flourished what it is today? It's tremendous what they did within the decade then. So makes me wonder, what are they going to say 50 years from now? I think it will be profound, because as a bar, a high bar that was set within the 1 decade landmark, by 1976, there was a freestanding mental health facility and administrative services, what was then called for mental retardation. And by 76, emergency services were established for mental health issues. And even then, they established a freestanding facility for treatment of substance abuse, and this is 76. And because that high bar, and in the loving hands of our administrators and clinicians, I believe that we are well underway for great things. So currently, addressing the substance abuse crisis, which is a crisis because the mortality is 300 times higher than that of your average American. 300 times higher. And so we're looking at a crisis which is met with I think singularly, with the multidisciplinary approach by Henrico County Mental Health and Developmental Services. And the crisis can be met by the same-day access. As you know, when somebody gets an inkling that they need help, despite their impairment, they have to be able to go in immediately and get that help. And we make it available. When there's a medical issue for anybody receiving services, Daniel has set up the medical clinic to address those needs. There's psychiatric services, medication assist services. There are inpatient services subsidized by the county. And that's been going on for decades, but it's been ever expanding. More currently, addicted moms and addicted moms-to-be are now receiving services. And so when I say that it's multidisciplinary, I mean it, because not only are they providing these services and triaging with the enforcement community, law enforcement community, they're also making headway in reintegrating and rehabilitating recovering individuals, recovering from substance use and abuse. And I just want to say that as somebody who receives services and as a physician heal thyself. That's not possible with this disease. It requires a multidisciplinary approach and a lot of help and a lot of TLC, which I really did receive. And I'm just honored to be here today as a board member and as a former recipient of excellent care. Thank you.
So in celebration of this anniversary, we have 3 really special people that we want to honor today who have been instrumental in the success of the agency. And I'd like to tell you a little bit about the 3 of them. The first is Nancy Cecil. Her daughters, Janet and Karen, are here today. And Nancy was a member of the Thomas Jefferson Junior Women's Club. She was the chair of the Mental Health Committee, and they were historic in their advocacy. They began to believe that this was a need in our community, so they developed a 2-year budget. They requested local funding. They went to the Henrico Board of Supervisors. They went to the General Assembly, and they were instrumental in the founding of what was originally called the Henrico Mental Hygiene Clinic. She was the chairwoman of the agency's first advisory board, now known as the Community Services Board. And later, she joined the agency in many capacities as mental health center administrator, as business manager, as facilities coordinator. I have heard about her that she loved buildings, and so her heart is seen in many of the buildings that the agency now manages. Nancy passed away in 2017, but I want to read an excerpt from a letter that was sent to her by James Funkhauser, who was the assistant commissioner of the Board of Developmental Services at the time. He said, "There was certainly not sufficient time to meet the required deadlines and obtaining approval of the Constitution and bylaws. I guess I will never understand how you cut through the red tape, obtained political support from former opponents, overcame the usual resistance to change and the plea for economy and government. I guess it was the result of dedicated purpose, dogged determination, and hard work. My congratulations again. From my observations and from other reports of the program, the Henrico Mental Hygiene Clinic is now performing a necessary and outstanding service to the community." So we want to honor Nancy by honoring her daughters. We're going to ask both of you to come forward. And we have a presentation for you all that is just our way of honoring the sacrifice and the determination that your mother had and the legacy that she leaves in this agency. Okay, the next person that we would like to honor, excuse me. The next person that we would like to honor is Mr. James Jim Stewart. He is, you can clap now if you want to. So Jim has over 27 years of experience with the agency. He was the mental health director from 1977 to 1981, and the executive director position was established in 1981. He held that position from then until 2004. So basically, Jim has always been in charge. He retired from the agency in January 2004, And then later worked for the department as Inspector General, was also former Commissioner of the Virginia Department of Behavioral Health and Developmental Services until his retirement in 2014. So he has more than 36 years of experience in delivering behavioral health and developmental services. And we want to honor you today, both for your illustrious career, but certainly for your commitment and your assistance in making this agency what it is today. Thank you. The final person we would like to honor today is Mr. Mike O'Connor. Mike also has 36 years of experience with the agency. He was coordinator of children's services, then director of outpatient services, then director of clinical services, then director of clinical and prevention services, and then the executive director. Mike was actually heading out as executive director when I was coming in as a board member, so he was my first introduction to the board in this wonderful agency. Mike also retired from the agency in August of 2014, and then later worked as a consultant for the Virginia Department of Behavioral Health and Developmental Services. And so again, Mike, we want to honor you both for your career, but also for your service to this agency. Thank you so much.
All right, we're almost done. But before we end, I would like to take a moment to share one additional part of our history. We recently participated in a 2-day needs assessment, not an audit, needs assessment, really an audit, with JBS International, who was working under contract with the Department of Behavioral Health and Developmental Services. During the exit interview, they shared some wow factors that they had experienced during their time with us. One of those was our strategic planning process and initiatives. They stated they had seen a strong sense of our mission and commitment to the individuals we served. They went on further to talk about how strategic planning really is often the one thing that sets other agencies apart from others, ensuring that the agency's culture and leadership continues to focus on their mission. And you heard the county manager talk about the staff here are wired a little different, and I like to believe that that's part of our mission. The work on our initial strategic plan was intentional and purposeful many years ago. The groundwork was set through the leadership of Jim Stewart, Mike O'Connor, Terry, Debbie, Wendy, Deborah, Yvonne, Peggy, Beth, Martha, Carolyn, and lots of other folks, including the Community Service Board and all the staff. It continues today through the efforts of all staff, the Community Service Board, our stakeholders, and our community partners. I'd just like to take a minute to read our vision and value statement. We serve people experiencing the effects of or at risk for mental illness, developmental disabilities, and substance use disorder, and children with developmental delays. Henrico Area Mental Health and Developmental Services promotes dignity, recovery, and self-sufficiency in the lives of the people we serve. We envision an inclusive, healthy, safe community where individuals lead full and productive lives. We value excellence, dignity, and partnership. We believe that leadership is the responsibility of everyone at Henrico Area Mental Health and Developmental Services. If we're to be successful, we must lead with integrity, good stewardship, openness, creativity, and full participation. These are words that guide our daily work. In conclusion, I have a couple of people I want to thank. The Community Services Board planned this celebration, so thank you for that work. And the committee consisted of Dr. Jessica Brown, Dr. Alison Batchelder, Nita Grignell, and Karen Metz. Yvonne Russell and Nancy Wigstad staffed the committee. I'd also like to thank Sandra Copeland, who designed the logo for our 50th anniversary and has volunteered with many other design projects through the years for us. Ryan Eubank produced a video of our history, and you'll see it kind of loop through after this is over. It really is excellent, and I hope you take the time to look at it. Public Relations and Media Services and Recreation and Parks for their support and logistics, and the many volunteers who are helping us today. Lastly, I want to thank the amazing staff, both past and present, who through your work and your dedication have made a tremendous difference in the lives of many. Please enjoy some cake, take a tour. We have tour guides, and spend some time visiting with each other. Thank you for coming today.